Do you want us to mute ourselves when we're not talking? Yes.
All right, I see we have some folks joining. We're gonna start promptly at 10 a.m. All right, so it is 10 a.m. by my watch, at least. So welcome everyone. Thank you so much for joining us. My name is Courtney Thomas. I'm the Director of Communications here at WREN, the Women's Rights and Empowerment Network. We have a mission to build a movement to advance the health, economic well-being, and rights of women, girls, and their families here in South Carolina. So we are so thankful that you have joined us here this morning. And I want to walk you through a little bit of what you can expect this morning. So if I could have the next slide, Maya. So after setting the scene a little bit, you'll hear from Ann Warner, the CEO of the Women's Rights and Empowerment Network, and she'll give you an overview of the gender wealth gap and our findings. Next, we'll have some remarks from the Sisters of Charity, and then we'll have a moderated conversation with some of our speakers today. And these folks are fantastic experts in their field. And then we're going to wrap it up. There will be some time for Q&A at the end of this session. So if you do have questions throughout the findings section or during our panel, I ask that you use the Q&A box to type in your question. And should we have time, we will absolutely address those questions. These questions will also be available on our website. So just in case we don't get to you, we will publish those answers on the site. And to that end, this session is currently being recorded. So I want you all to be aware of that. The brief, the policy brief and the recording themselves will be available at scwren.org/research. And we'll remind you of that again at the end of this session. Our engineer is Maya Ward. If you have any technical issues or if you just have any thoughts to share with us throughout the duration of this session, feel free to chat her privately in the chat box. You'll be able to find her name under Maya Ward. Closed captioning is available. Click the CC at the bottom of your screen. Thank you to Chloe Holachenko for providing our live captioning. That is a Herculean task, so we are so thankful for your work there. And I think that is all I have to share with you. So with that, I am going to turn it over to Ann Warner, our CEO. Actually, I'm not doing that yet. So let me just go ahead and give you a preview of our speakers. So today we are so thankful to be joined by Nichelle Harrison, the Director of Operations for the Center for Courage and Renewal, and she's also the owner of the MAP agency. We'll have Ann Warner, the CEO of the Women's Rights and Empowerment Network, Bernie Mazik, the President and CEO of the South Carolina Association for Community Economic Development, Tammy Hoy Hawkins, the CEO of Community Works, myself, and Meredith Matthews, Program Director at the Sisters of Charity Foundation of South Carolina. So thank you so much for joining us. And now I'm going to turn it over to Ann.
Thank you, Courtney. And I want to start out my remarks with acknowledgements of the many people who've contributed to the work that we're going to share with you today. First and foremost, the WREN team, our entire team has contributed to this in some way, shape, or form. But Brandy Parrish-Ellison, Ashley Crary-Lito, Chloe Helichenko, and Maya Ward have really put in a tremendous amount of work to do the literature review, synthesize the data, and make it accessible in the form of documents in this PowerPoint presentation today. We also want to thank Dr. Jessie Wang, a professor of economics at Furman University, who was the research consultant and led the way on the quantitative analysis that we'll be sharing with you today. And we want to thank our funding partners, particularly the Sisters of Charity Foundation of South Carolina, who provided the funding for this brief specifically, and also to Hollingsworth Funds and Jolly Foundation, who are helping us do some continuation work of these findings. And we will be telling you more about that after we share this initial set of findings with you. There will be more to come. And I want to share that our goal in this brief and in this discussion today is to raise awareness of the gender and racial wealth gap in South Carolina, to differentiate it from the income or the wage gap, to explain why it's so important, and to begin to enlist more stakeholders in a commitment and action towards closing the wealth gap. This is just one step. Action must follow. We provide some high-level policy recommendations in the brief, and we're going to hear from these excellent speakers today and from some of you about what you see as the way forward. But we know that a lot more work is needed, and we're looking forward in the coming months to talking to more partners and to some of the people who are most affected by the wealth gap in our state, who can help us inform what those solutions should be and work with us towards implementing them. Okay, if we go to the next slide, the important thing to do is establish what we mean by wealth. So wealth is equivalent to net worth, or the total value of assets minus all liabilities or debts. And when we talk about the gender and racial wealth gap, we're really talking about how that individual level net worth is differentiated by gender or by racial identity. The wage gap is often used as a benchmark to look at inequality, but wealth is really a more comprehensive measure of financial well-being than income alone. So that's why we really want to raise awareness of this more comprehensive benchmark, the wealth gap, and how it's differentiated by gender and race in South Carolina. Wealth, if you go to the next slide, wealth is really important because it allows us to cope when there are unexpected challenges that always arise for any of us: unemployment, illness, financial emergencies. The COVID pandemic is a huge example of why wealth is so important, because we never know when health challenge or job loss is going to arise. And so it allows us to be able to weather those kinds of crises. Wealth also allows us to plan for the future, for our own lives, for those people in our household who depend on us, and also provide something to be able to pass on to future generations. So we wanted to know, what is the status of the gender and racial wealth gap in South Carolina? So again, we consulted with Dr. Jessie Wang, an economist and assistant professor at Furman University. You go to the next slide, you can see a little bit more information about the methodology and data source that Dr. Wayne used to help us answer these questions. So we used the survey of income and program participation, which is a household-based survey designed as a continuous series of national panels. And it allows us to compare the average wealth levels for women and men, and also to compare average wealth levels of white people compared to people of color. The data set doesn't allow us to differentiate beyond that. We don't have the sample size to be able to go into a lot more detail on racial, ethnic identity, age, and many other factors, but it does allow us to get a sense of what the overall racial and gender wealth gap is in South Carolina. A couple of more notes on limitations. In general, wealth data is very hard to collect. It requires getting a lot of information from individuals about assets and debts. It's costly, and most large data sets don't have all that information. So SIP is the best we have. It's not representative across demographic characteristics, and it oversamples the rich. So these are likely conservative estimates of the true extent of the wealth gap in South Carolina. We need to do more work, and case studies and qualitative work will probably allow us to get more insight into the individual and household level dynamics that lead to wealth accumulation. So we're going to give a couple of high-level findings in this presentation. There are more findings in the policy brief, and we hope that you'll look at that on our website. If you go to the next slide, though, you can see that looking by gender alone across racial groups, that the average wealth of men in South Carolina is about $434,641 compared to the average wealth of women, which is about $92,610. This equates to a gender wealth gap of 78.7% for women overall. In other words, women own about 21 cents for every dollar that men own in South Carolina. Another way of saying that is that men own nearly 5 times more wealth than women own. If you go to the next slide, this shows gender and race together. The gap between women of color and white men is 95.5% in South Carolina. Another way of saying this is, on average, women of color own 4.5 cents for every dollar that white men own, or white men own more than 22 times the wealth that women of color do in South Carolina. There are also additional findings that look differences between women of color and white women in the brief, and also by overall the racial wealth gap. Those again are available in the policy brief. The next slide shows you how South Carolina compares to the national average, as well as to some of our neighboring states that have similar wealth levels and demographics. And you can see that the wealth gap here is higher than the national average, which is about 52.2%, and higher than neighboring states like Georgia and Alabama, again, that have similar wealth levels and demographics. So these are estimates, but they lead us to the conclusion that South Carolina is a place where it is extremely difficult for women, especially women of color, to accumulate wealth. And this is a major impediment to economic dignity and security. Why is there such a huge wealth gap in South Carolina? Well, there are a lot of reasons, and we want to acknowledge that there are many historical factors, that the racial wealth gap is rooted in generations of exploitation, discrimination, and violence against Black people in this country, beginning with enslavement and perpetuated in racist systems and policies over many generations and up to present day. It's also rooted in the undervaluing of women's work and discrimination against women in political and social and economic life throughout our history. Women of color, namely Black women, Latinx women, and Native women, are disproportionately affected by the wealth gap. Our policy brief does not delve into these really important historical underpinnings of the phenomenon we're seeing today, but there are many excellent resources on this that we will highlight on, or we'll provide some additional resources on our website. So in the next few slides, we're going to talk more about the proximal or more contemporary drivers of the wealth gap. We'll try to answer, I see some questions coming up. We'll try to answer those at the end. And thank you for that question. And if we can't get to it today or right now, we'll get back to you later. Education is certainly a factor. We weren't able to isolate that in the quantitative analysis because of the limitations of the data set, but we will talk about education. So if we go down to if you go to the next slide, Maya. I think we might be to the income inequality slide. Oh, there we go. Okay, great. Sorry, I thought we were still on the earlier slide. Thank you, Maya. So we talked about income inequality briefly. It is one of the biggest contributors to the overall wealth gap. So the gender wage gap is a measure of what women are paid relative to men. South Carolina has a larger wage gap than the national average. On average, a Black woman in South Carolina is paid about 57.5 cents to every dollar paid to a white man. And across racial groups, the average South Carolina woman is paid 77.3 cents compared to the average man. One of the reasons for these huge disparities is that women are significantly overrepresented in the low-wage workforce in South Carolina. About 70% of our low-wage workforce is female. And Black women in particular are disproportionately segregated into low-wage jobs and paid less for their work. Lower wages leave women with less ability to pay for childcare, mortgage payments, tuition fees, build up savings for retirement, pay for health insurance premiums, and cover a whole host of other household expenses. And this has cumulative effects. So because of this gap, women in South Carolina are likely to experience an average annual loss between around $11,000 and around $22,000 compared to their male counterparts, depending on their race. So this is a huge loss that accumulates not only over the course of a year, but over the course of a working woman's lifetime. So to catch up to what the average white South Carolina is paid, white South Carolina man is paid by the age of 60, depending on her race, a South Carolina woman would need to work anywhere from 12 to 34 additional years. Next slide. Women-owned businesses in South Carolina. We have one of the highest growing rates of women-owned businesses in the country. We were ranked 4th in the country late last year. And one of the reasons for this is that women often create their own businesses because the workforce isn't providing what they want and need, and women are resilient and resourceful and go off on their own. And so this is a bright spot for South Carolina in many ways, but also women who own businesses face many of similar challenges as other women in the workforce. These businesses are typically smaller in size, and they generate lower revenues and profits for owners and employees. This is because women business owners have less access to business financing, less cash to start with, and often less access to business education, training, markets, and mentors. Also, women have less access to credit and wealth building tools, so less money available for investments and savings. Women tend to owe less than men, but they often have lower credit scores. And women can often become the victims of predatory lending, utilizing subprime loans that often lead to higher debts and to strip them of their wealth. Next slide. Women tend to live longer than men. So they're more likely to rely on Social Security, but they receive less Social Security benefits during retirement because they have lower wages during their working years. And a lot of time women are taking time off out of the labor force or working part-time because of caregiving. And that brings us to the next slide, which is focused on unpaid labor. The Organization of Economic Cooperation and Development defines unpaid labor as time spent doing routine housework, shopping for necessary household goods, childcare, tending to the elderly or other household members, and other unpaid activities related to household maintenance. Women do the vast majority of caregiving in our society, both paid and unpaid. But this financial burden forces women to do more tasks with fewer means. And in the US, it's estimated that the annual cost of unpaid labor provided by women ranges from 148 billion to 188 billion annually. Now we're going to look at some of the more significant expenses that women have. So educational debt. Women are enrolling and graduating from higher education at a higher rate than men and have been for decades. So they're earning more than half of associate's, bachelor's, and master's degrees. And this is often seen as a pathway towards building wealth, but it comes with high amounts of debt. And that compounded with women coming out of the workforce and immediately earning less. I mean, you can see the wage gap. This data isn't in this presentation, but the wage gap starts very early on in the working years. So when women have higher debt and they're earning less, women end up paying a higher percentage of their already lower income to student debt loans each month. Medical debt on the next slide. South Carolina has high rates of uninsured women. Women between the ages of 19 and 64 are more likely to be insured than the national average. And Black women, Latinx women, and Asian American women in South Carolina are disproportionately likely to lack health insurance. So lacking health insurance for oneself or to cover the needs of other people in the household means that women are susceptible to medical debt, which is of course a liability that is detrimental to their ability to build wealth. The next slide, childcare is a huge topic. We could spend an hour on this one alone. But in a state where single women had over 4 times as many households with young children as single men, the costs of childcare are a major driver of the gender wealth gap. So the lack of access to childcare affects women's ability to work. 42% of families in South Carolina live in a childcare desert, and this number is higher, up to half, for those who live in rural communities. Also, the costs of childcare are very high. For a single parent in South Carolina, the cost of center-based childcare would consume nearly 40% of total income. And infant care would only be considered affordable for the top 21% of South Carolina families. All of these factors are being exacerbated due to COVID. And it's important to note that we wrote this brief pretty much before COVID hit, but it's critical to underscore the enormous toll that COVID is having on the health and livelihoods of women, on people of color, particularly Black and Latinx people in our state and in our country. And a couple of statistics to note is that more than 2/3 of jobs deemed high risk because of their exposure to the public are held by women. These are our healthcare workers, our childcare workers, our retail workers, our food service workers. So the people who we have been depending on to keep our economy running are disproportionately women and women of color who are often not making enough to make ends meet, and who are now suffering the most from the surging levels of unemployment. So we know that the unemployment numbers have been astronomical these past few months, but when you break it down by race and gender, you see who is being affected the most. This bar chart on the right of your screen is based on national numbers. We don't have great data here in South Carolina yet. We're working on that, but we can be certain that some of these same phenomenon that we're witnessing nationally are definitely playing out here in South Carolina. And while I'm sure hear more from our speakers on how COVID is shaping the work that they do. So in conclusion, the implications of the wealth gap are at the individual level, household level, and the societal level. So for individual women, being able to accumulate assets and save is a matter of economic dignity and security. We all need resources to be able to draw on to allow us to not only meet our basic needs, manage crises that inevitably arise, but also to be able to plan for and invest in our futures. And this also has huge implications for the household level. Women tend to invest more of what they earn and have in the health and well-being of children and other dependents, but they can't invest what they don't have. And in a state where single women head over 4 times as many households with young children as single men, and more than 1/4 of households with children under the age of 18 are led by single women, the systemic gender and racial wealth gap is hurting our families. This also has profound intergenerational consequences. As we mentioned at the beginning, wealth is important because you can pass it on to future generations. So when parents have less to pass on, a child's chance of moving up in the income distribution relative to her parents is severely curtailed. So if we strive for economic dignity and economic mobility for South Carolina, it's crucial that we prioritize closing the gender and racial wealth gap. Now I will turn it back to Courtney.
All right. Thank you so much, Anne. So before we get into the panel discussion, I do want to turn it over to Meredith Matthews for some remarks from the Sisters of Charity Foundation of South Carolina.
Thanks so much, Courtney. So I promise that I'll keep this very brief because I know we're all really excited to hear from the amazing leaders on this panel today, but I appreciate y'all inviting us to say a few words. So first, on behalf of the Sisters of Charity Foundation of South Carolina, I want to express our gratitude to the team at WREN for the opportunity to partner with y'all on this really, really important project, and also just to underscore why we firmly believe that this work is so important. So at the Sisters of Charity Foundation, all of our work is focused on the needs of people experiencing poverty throughout South Carolina. And we do this through advocacy, policy, and grant making. And we're really fortunate to partner with and learn from organizations all throughout the state whose programs exist really along the full spectrum of this work, right? So that includes organizations like WREN who are influencing and guiding change in those structural systems that create and sustain and reinforce the marginalization of people experiencing poverty. And then of course, all of those amazing direct service providers who see the reality of how these systems play out in people's day-to-day lives. And what's so powerful about this report is that it gives us a look into how these systems play out in South Carolina and the injustices that people are facing. Because poverty in and of itself is an injustice, right? And in every slide that Anne just showed us, we see this compounded even further at the intersection of race and gender, and even further in the midst of a global pandemic. And we see really clearly how the allocation of power and opportunities exclude women in South Carolina, especially women of color, and the reality of the disproportionate impact of COVID, like Anne just talked about. So the reality of this, that this data and this report exposes, has to inform what we do now, and not just what we do, but how we do it. And we can't do this work for real, do this work unless equity is in the center, right? And so again, on behalf of the Sisters of Charity Foundation, thank you so much to the team at WREN for your work here and for fighting along so many people in our state who've been doing this work. I know there's a lot of people on this call who've been doing this work for a long time, and this report reaffirms what you see every day. And I hope it also reminds you of the importance and validity and absolute necessity of what each of you are doing every day to work towards justice. We are deeply, deeply grateful to do this work alongside you all. So thank you again. And I'll kick it back to you, Courtney, to intro our panel.
All right, wonderful. Thank you, Meredith, and thank you, Anne. So we've had some scene setting and some data from Anne and Meredith. Now it's time to get into the panel. So I do have an opening question for each of our panelists. And before you answer, I would like each of you to once again give us your first name, last name, and your pronouns. So here's the question that I'm going to address to each of you. Do you see evidence of the gender and racial wealth gap in the work that you do? How is the COVID-19 pandemic affecting the gender and racial wealth gap? So first, I'm going to go to Tammy.
Good morning, everyone. Again, Tammy Hoy Hawkins with Community Works, she, her. I'm really honored to be here today. And to your question, here at Community Works, we serve a lot of small businesses. In particular, our core focus is on women of color. And certainly, on average, income for our clients is around $32,000 per household, which the median in South Carolina is $52,000. So you can just see just that $20,000 gap just in median income in the population we serve. And that is actually 9% lower than the male clients that we have here in South Carolina as well. In terms of credit score, we see our average credit score for our clients at around 567, which, as you know, is a subprime score, which is tends to be very challenging. The average credit score in South Carolina is 681, so a huge disparity in just overall credit score. So as the report suggested, access to credit, access to financing, access to those wealth building opportunities for small businesses makes it more difficult for women, and in particular women of color, to access some of those important resources. In terms of the pandemic, and I know we're going to talk more about this, we certainly have seen a huge challenge for our women businesses, in particular our African-American women businesses. And again, that goes to what Anne was sharing, the types of businesses that some of our women lead, like childcare, retail, healthcare, lifestyle businesses, tend to be more impacted by the pandemic since they're high touch. It's hard to social distance in some of these businesses, as you all know. So again, it's more of a challenge for them. So that's a quick overview of kind of some of what we're seeing, and I know we'll share more.
Thank you for that, Tammy. And can I also ask panelists to tell us where you're located in the state? So next, I'm going to go to Bernie. If you can introduce yourself and answer our first question.
Good morning. Bernie Mazik with the South Carolina Association for Community Economic Development, SCASID, headquartered in Charleston, South Carolina. He, him, his. I also want to add my thanks to Ren, not only for this great work that you've done, but for your years of partnership with SCASID as we seek to put in place policies in South Carolina that will help marginalized and low wealth communities and families throughout South Carolina. Yes, we definitely see evidence of gender and racial wealth gap in our work in SCASID. We have over 150 member organizations, partners, allies that are all doing some level of work with low wealth communities and individuals and families led by female heads of household. And we've seen the evidence of this. SCASID's mission is to improve the quality of life for low wealth families and communities in South Carolina. The data continues to remind us of the racial and gender wealth gap that exists in the state. One of the reports that we subscribe to is a scorecard produced by Prosperity Now based in Washington. And annually they produce a scorecard of the 50 states and the District of Columbia on measures of prosperity. In 2020, the scorecard ranked South Carolina 50th in the nation in measures of prosperity. And for the first time, the piece that really influenced that was a new measure that they included, which was the ranking on racial disparities. And so South Carolina ranked 46th in addressing racial disparities. Of course, Ren and Ann, in your report, disaggregated the data by gender and race. And so you can see very clearly the specific impact on people of color and by gender, the tremendous challenges we have here in South Carolina. COVID-19 has exacerbated that wealth gap. What we've seen so far with organizations serving communities of color and African-American businesses, what we saw was that these organizations and African-American-led businesses were not prepared and in a position to really access the federal resources. I'm sure Tammy can speak to it as well, that so many great businesses just did not have the back office set up in order to access these resources. So we have a lot of work to do there, and we look forward to discussing this further in our conversation this morning.
All right, thank you. Next, I'm going to go to Nichelle.
Thank you, Courtney, so much, and thank you, Ann. And again, I'm going to echo what everyone says. Thank you so much for the work that Ren continues to do in our state and inviting me here. So I work with two agencies here in Greenville, South Carolina. And by the way, for my pronouns, she, her, hers. I work with two agencies here in Greenville, South Carolina, and they both concentrate in the areas of inequality. So I definitely see the evidence of the gender and racial wealth gap in the work that I do. The majority of the women that I've worked with over the past few years are either returning to the workforce after a career break, or they have the need to pivot in their career. And when these women return to the workforce after a career break, they can already expect to earn about 7% less. So that sounds like a small amount, but in the big scheme of things, we all know that makes a major difference. And when you're already starting off at a deficit, when you're already not making enough money from the beginning, taking that career break, then stepping back in, and then losing more money is no good for anybody. One of the reasons we pivot in our careers is because we aren't being paid enough in the beginning. And that regular income, although it's important for our daily living, it's just not sufficient for our overall well-being of women and families here. And I know you asked how COVID is affecting the gender and racial gap. So COVID-19 was what or this gender and racial wealth gap is a shadow pandemic. You know, it's just as urgent as this COVID-19 pandemic that we're living in. And that the racial wealth gap, you know, we all know that wealth affects the way we respond in emergencies because it creates that security and it creates that protection. But when you've been operating for so long at these disadvantages, it's almost impossible to stay afloat when something like a pandemic hits. So you go further in the hole, increasing the likelihood that the generations will follow. So COVID-19 is definitely increasing, these gaps that we're talking about today, and it's not slowing down. Like, it's here to stay, and we really have to do something about it.
Thank you for those insights, Nichelle. And I do want to follow up on that with you, Nichelle, and kind of dig a little deeper into that. So COVID has created just unprecedented job loss, and women, particularly women of color, are suffering the most. So what are you seeing as a small business owner that helps women navigate career transitions? Like, what are people experiencing on the ground in your experience?
Well, you know what? I'm actually seeing women be more strategic about their career choices that they're making. Women, and I know Ann said this at the beginning, we are very resilient. So, history has made us that way, but I'm seeing us be actually more strategic about, our career choices. We're educating ourselves, although that puts us in more debt. So, but we know that there's no other way to do it. So we're continuing to go in this cycle of trying to do things that are good for us, but we aren't getting any relief for it. That's causing us to, reach a little further out into these things, into these areas. But it's definitely, I think we're taking a lot of the women that I'm working with, I'm seeing them take on additional responsibilities, additional titles, in their job. COVID has us thinking about how to, step up, our career game. We know that we're responsible for taking care of our families. A lot of the things that Ann said, women have invest more in our families, in our communities, and we feel that pressure. And we're not feeling that relief right now. We're not feeling it right now.
Thank you, Nichelle. And just as a reminder to our attendees, you can type any of your questions in the Q&A box, and should we have time at the end of this moderated discussion, we will address your questions. All right. Next, I want to turn to Tammy. Women were the largest group of small business growth, and they've already faced barriers to getting capital for their businesses. Have COVID small business relief efforts reached women-owned businesses? What else needs to be done to stabilize and strengthen women-owned businesses in South Carolina?
Yeah, thank you. And I know Bernie referenced Prosperity Now as a resource that many of us look at in terms of how we're doing. And just one of the data points on that, business value, 3 times higher for men, 3.5 times higher for men than women. So already women were at a disadvantage in terms of the value of their business. And in many cases, they didn't have reserves, lack of cash, which the study referenced as well, a lack of savings, potentially. And again, because of the generational wealth gap in many cases in women and people of color businesses, didn't have some of those safety nets that maybe other businesses would have had. So with the pandemic, what we saw with some of the federal programs, and Bernie referenced this as well, because of the historical distrust with financial institutions and the lack of relationships with financial institutions, many women, and in particular women of color, didn't have good relationships with their banking partners. And as you may remember, the Paycheck Protection Program was directly through a financial institution. Fortunately, because Community Works is an SBA lender and has been doing small and micro business lending for quite some time, we were able to participate in that program. Unfortunately, we found out during the second round. So the first round, we were still trying to get approval, but many of the women that we worked with were about 50% of the Paycheck Protection programs that we did were female-owned businesses, and 20% of those were Black-owned businesses. And that's only half the data points right now. We still are collecting the demographic data points on the loans that we closed. And on average, those businesses only needed about $12,000 to shore up their business. So again, a very small amount of money to actually help them over the next couple months. And now with reopening, again, because they didn't have some of the cash set aside or the reserves, we're seeing a demand for additional capital sources. And again, many of the folks that came to us said, I've had a banking relationship, but maybe they didn't have a lending relationship. They may have had a depository relationship. That they tried to apply for the PPP loan, but they were told their loan was too small. They were told that they were no longer providing loans. So again, some of those were some of the barriers. And again, that goes back to some of the data points in the study around those traditional relationships, those systemic and institutional barriers for both women and women of color. So that is really a lot of what we've seen. And so we have been at Community Works really focusing on, to Nichelle's point, on creating those mentorships, creating financial education, and looking at how do we increase some of those credit scores with our financial coaching. And again, I think in addition is how do we prepare a resiliency plan for these businesses going forward?
All right, thank you. I do want to speak with you, Bernie, a little bit about some of the work that you've been doing. You've actually called attention to this racial wealth gap in South Carolina for quite some time, and you've written about it and spoken about the factors that contribute to it. Access to safe and affordable housing is absolutely an important pathway to building wealth. And we saw some of that in the data that Anne gave us today. What can we do in this state to ensure that women in particular are better able to access safe and affordable housing for themselves and for their families?
I need to take myself off mute first. Thank you, Courtney. And housing, of course, is usually the first and a key asset for building wealth for families. The development of and access to affordable housing is driven largely by public policies and practices of financial institutions. One of the challenges around housing is cost and access. And we run into this factor and feature we call cost burden. How much a house or the cost of accessing or purchasing or renting provides a burden to the family budget. Usually cost burden is measured anything over 30% of a family household income that's devoted to housing that places housing as a cost burden to the family. And for South Carolina, for renters, cost burden rates, according to Prosperity Now, is 48.8% for renters, and for homeowners is 25.5%. So we see housing in South Carolina is a cost burden to families to be able to access that. First, as I mentioned, policy is so critical to helping give individuals and families access to safe and affordable housing. And Anne and all your team at REN, I want to lift up your policy recommendations as a great element to working towards not only affordable housing, but just building wealth. So thank you for those policy recommendations. I want to highlight a few more, and some of these recommendations may even elevate your recommendations. But I want to highlight 4 or 5. 1, minimum wage in South Carolina. We've got to work on the income side, minimum wage. 2, payday and predatory lending, which Anne mentioned before. 3, tax incentives that can play a role in helping individuals and families build wealth. And finally, more financial education, credit counseling, home buyer education that helps families and individuals be able to work within the financial systems that we have. On the minimum wage front, the fact that our minimum wage, $8.75 an hour, is atrocious. And what we really need to be pushing for is, as your report highlights, a living wage. so that families, and especially women and women of color, don't have to be working 3 and 4 jobs in order to afford a house. So we really got to work on the income side, and in order to affect and help women to access more safe and affordable housing. Debt is also, as you've highlighted, debt is a challenge as well. And payday and predatory lenders are playing a major role in suppressing the ability of women and women of color to access affordable housing, use their income to access affordable housing. South Carolina really does not protect against predatory lenders. North Carolina does, Georgia does. And so what that means is predatory lenders have found their way to South Carolina in great numbers. In South Carolina, payday lenders, the interest rate is capped at 391%, 391% for a payday loan. And they can have as many as 3 to 4 to 5 payday loans simultaneously. And of course, when you have a low income, you have emergency expenses, sometimes you have to turn to other means in order to access capital. Payday lenders are available, accessible, but they're also very expensive. So we need legislation that will prevent or cap, at best, prevent payday lenders from operating in South Carolina. Of course, we need to work on providing alternatives to payday lenders. We also need to, of course, increase the supply of affordable housing in the state. And since public policy plays such a key role in that, we need more tax credits, we need more tax incentives, we need more tools that will help produce more affordable housing in the state. And this legislative session, there was legislation passed in the state that will provide additional tools for affordable rental housing, but we need the same tools for home ownership as well. And so I'd mentioned another tax incentive that has been put in place, which is a state earned income tax credit. Unfortunately, that tax credit is non-refundable. So it does not provide the same resources at the state level that the federal EITC provides. And so we need that. We need to continue to fight for that. And I would be remiss if I didn't mention a community development tax credit that REN has been assisting us in advancing. We need more of those tax credits to help with the supply and the development of affordable housing, and to help Community Works, for example, Tammy's organization, to be able to access private capital to provide mortgage loans, small business loans for women and women of color. And then finally, as I mentioned, the financial education, credit counseling, home buyer education, those require resources as well. So we need to work for resources to fund organizations that's providing that very critical assistance to our families, to our women and women of color in South Carolina. If we work towards, and there are many others, but in addition to REN's policy recommendations, these we think will go a long way to helping to increase the access of women and women of color to affordable housing.
Thank you, Bernie. So you actually teed us up very nicely to kind of wrap it up with our panel here, because in Anne's presentation, we talked about how many different factors actually add up to what wealth is or what it isn't. And as complicated as measuring wealth is, some of the solutions might need to be multifaceted as well. So for our panelists, our quick closing, I do want to ask each of you, the gender and racial wealth gap is in itself a product of generations of discrimination and marginalization. So in 1 or 2 sentences, what do we need to start doing differently today to close that gap? And Bernie, I'll come back to you since you gave us some recommendations, but I do want to start with Nichelle and then Tammy, and then we'll go back to you, Bernie. Okay?
Thanks, Courtney. Today, what we can do, we can support public policies, the ones that we're talking about today. We can support those public policies. We can support those organizations that are intentional about disrupting these systems that hold so many people back. And you can educate somebody today. You can educate someone on what you learned here today. And I want to say, when we talk about wealth, we're not talking about millions of dollars. We're talking about, money that people can get their hands on. So I don't want people to be turned away because we're using the word wealth. We're talking about what you can get your hands on when you need it. So we need to just continue to have these conversations.
Yeah, and I would agree with Nichelle. And of course, Bernie did lay out a really great policy agenda that many of us attest to and sign on to. And so again, furthering that state policy agenda and supporting one another. I would also add just the continual mentorship and the connections of one another. These, not only our own agencies, but connecting women business owners. I will share with you guys a little pre-information. We are actually launching a women's business center here in Greenville at Community Works. And you'll hear more about that soon. And so again, those intentional networks, and again, obviously identifying ways to increase capital sources as well. One of the other things with our women that we've worked with, only 10%, there was about 10% of our women businesses that didn't have any savings or were unbanked. And so again, making those connections with financial institutions that are supportive of our work. And then in addition to the policy, not only locally, but nationally uplifting this conversation around equity. And I guess at that end, keeping equity at the center of all of our work and what we do, and being very intentional about that everything we do is centered on equity, I think is critical to our networks and our relationships and trying to uplift solving many of these wealth gaps.
And I say kudos and amen to everything that everyone else has said. You've already begun the process today, Ann and Courtney and others, with this information. We've got to push this information out as far as we can. We have to find venues to get this kind of data and this kind of report in front of as many partners and allies as possible. So thank you for beginning this conversation. Secondly, I'd say we all need to engage elected officials. Yes, this is an election year, but every day we've got to connect with our own elected official at the local level, county council member, city council member, mayor, state house member, state senator, U.S. senator, U.S. congressperson, in their face with this information. We've got to let them know where we stand, that everything is not great. And so we've got to give them this kind of information and force them to address it. Another area that I would say, finally, is participate in the census. Please participate in the census. The census is going to serve, has served, and will serve as a base level of data that will tell us 10 years from now how well we've done. So I plead with everyone on the call, participate in the census and get your friend, get your mom, get your aunt, get anyone that you connect with to participate in the census. That is going to be key. With COVID-19, there's a concern that there will again be an undercounted population because folk are sheltering in place, don't feel comfortable with the mail system and so forth. When those enumerators come knocking on the door, they're not going to want to engage them. So please, let's get folk involved with the census. And if we're able to do these things, we'll go a long way to moving this conversation forward.
Mm-hmm.
Thank you all so much. Oh, Nichelle, did you have?
I did. I wanted to just add one thing, because I don't think that and it's, again, just a reminder of how important this conversation is, because women are crucial economic actors here in our society. Women drive 70 to 80% of all consumer purchases. So when we're not making that money, it affects our businesses, it affects our communities, and it absolutely affects our families. So I just wanted to add that.
Thank you for that. And thank you again to all of our speakers and panelists. We really appreciate your expertise and your time. So I do want to honor the time of the folks that we have on this webinar. So to close, I just want to let folks know once again. Maya, would you mind bringing up the PowerPoint? To let folks know that this information will be available at scwren.org/research. So there will be access to this recording itself, plus the slides, and the full brief will be available for download. So I absolutely encourage you all to share that information. You can follow us on Facebook, Twitter, and Instagram. We're at WREN Network. And it's also very important for you to understand that WREN is an advocacy organization, right? So we use data-informed. Data really does inform a lot of what we do. So that is the hard qualitative data or quantitative data, but also qualitative. So we want to make sure that folks are able to take this information and push towards change. So it's identifying the issue, but also advocating for solutions. And before we go, Anne, is there anything else that you want to add? All right, we do have another webinar coming up next week on Be the Voice. That was an incredible project that we just wrapped up that really advocated for reproductive health and rights here in South Carolina. So you can register for that at scwren.org/events. Thank you all so much for being here. Have a great day.